Hello everyone and welcome to our channel. My name is Dr. Chini and today we're going to be talking about how to breastfeed in public. So this is my second time around and I can honestly tell you the difference between my first experience and this second one. With my first baby, I only went out for hospital appointments, for outings that involved me being in the car, someone else driving, and then I'm going to somewhere that is a private place. You wouldn't see me out shopping in the mall. You would rarely see me doing that. You would rarely see me going grocery shopping. I was always trying to cut my time and duration outside so that I'm able to come home or be in a private place that I can nurse my baby. So this is a big challenge for first-time moms. This is really why many first-time moms don't go out. So you're coming from that place where you're like a young girl, you just had your baby, you feel very cautious of your boobs out in the public. Not just, your cleavage and all that, but you're dealing with your whole personal thing. Like you're focused on that being out in the public. So today we're going to just break all those shells so that you will go out and you will crush it without caring what anybody is going to say. Okay? So the first point is you have to prepare. You have to prepare before going on this journey. You don't just appear and find yourself in a situation where, oh, sorry, a minute, I have to breastfeed. My baby is hungry. No, you don't let that should not happen. You should have planned and thought this through even before baby coming. So a lot of us will buy our nursing cover when we're shopping for our baby things during pregnancy. But the reality of the matter is that what you planned in many areas before baby coming does not always turn out to be as you planned it. Is there any way to sign that, seal it? Because that's the honest fact. Like, we build everything in our head, we'll map out everything, we'll plan how we're going to deliver, we'll plan how we're going to crush this, crush that, finish this, ace it through all the steps, but it never always turn out that way. Sometimes we're lucky, some other times is a huge struggle that it kicks you out of your path and you're trying to recover. I deviate. So let's come back to the point. Like I said, plan. Think about it. I'm going to be outside. My baby is going to be hungry and I'm going to feed. So mentally, you have to walk that through. That you're not going to be looking at your baby crying and not feeding. Let's play it as an adult. You're hungry. You can't tolerate delaying for some time, but your baby eats and breast milk stays a very short time and is digested and your baby is hungry and that baby needs to eat. Is disturbing you, is disturbing everyone around. Like, your baby's cries is disturbing everyone as well. So you really need to feed your baby, not because of your outside. So that's mental preparation. You've prepared yourself. Second aspect of preparation is your outfit. So if you're going to be nursing your baby outside, you can't be wearing a dress that does not even have you cannot wear a turtleneck dress without zip, without nothing, without nursing section area, whatever it may be. Your dress code has to be breastfeeding friendly. So when I mean breastfeeding friendly, meaning if you're wearing, you can wear a top. So I'm just wearing a top. This is a top. You can wear an off-shoulder cloth, top, dress. You can wear a button down. Everything that can give you access to your breast easily and help you feed your baby, you need that. So secondly, that I will recommend when it comes to clothing is, if you can't you need a nursing bra. You need a nursing bra. It makes a lot of things easier, because when you have to move all your breasts up, like the bra up, is a lot more complicated, and as a first-time mom, it will give you a lot more struggle than when you just have to unclip your nursing bra to nurse your baby. So the third thing I will recommend when it comes to clothing is a nursing tank top or a tank top that is very stretchy. So when I say tank top, I'm going to show you guys what exactly I'm wearing here. So here, this is a nursing tank top, and you can see it has its own clip. So it clips as well. So this is me trying to clip it back, but you can see very well that it clips the same way as my nursing bra. My nursing bra has a clip as well. So let's say so I'll give an example. I'm wearing this now, and let's say I'm wearing like a different top. Like this top is very transparent. So let's just say I'm using like a cotton top or a t-shirt and all that, right? And I want to nurse my baby by lifting up my top. So when I lift it up, right, because of this is covered, so just ignore this whole thing that is clear now, because this is a covered thing, so it sits here, and I can just unclip my nursing tank top and then unclip my bra and put my baby and feed. So the top part, this part of my top, which is a normal, like a, not this lace, right, will be covering the upper part of my breast and some of the baby's mouth. So when it comes to preparation, just imagine that. Don't really feel that your breast will always be out there. No. If you do it like this, many times people are just seeing your baby nursing, but they cannot see any part of your breast. Honestly, like this is what I do sometimes. So what's the benefit of this tank top that is nursing? It also covers your mommy belly. Like we all know the struggle, the postpartum struggle is real. Like irrespective of how anybody tries to portray it and all that, deep down in your mind is real. Like you're handling it, you're dealing with it, but you don't want anybody else to be looking at it, especially those early times when there's still some hyperpigmentation and the linea nigra is still very obvious. You don't want those. So that's what I would recommend. The other option is having a tank top and then you use like a wrap or a nursing cover. We already know the nursing cover that you put over and then cover. To be honest, many babies fight through that. Worse when you're in a hot temperature area. Many babies will struggle with the nursing thing, but sometimes I use the nursing cover for my first, but this time around I don't use it. I don't even know where, like it's packed somewhere, but I did not bring it out. So what I use now is like a very light muslin or the hand towel I use for my baby. I just put it over here just for a little cover because my breast is not going to be out there in public. And at this stage of my life, I really don't mind. So, but this, like I'm trying to explain to you as being a first-time mom or a mom that is going through this, okay? So what you wear is part of your preparation before you leave your house to get there. You understand? So it has to be something that is breastfeeding friendly, something that will give you access. So the second thing is your baby is crying, so you find your perfect spot. If you are in a car, yes, that's a very good place to feed. If you find yourself in a mall that has like a breastfeeding place, then you can take advantage of that. If you're in a restaurant and other people are eating and you cannot go looking for anything, you sit where you are and nurse your baby. And what you can do, because of you've already prepared, because of you're wearing a tank top underneath and you're wearing a top, because you're using an off shoulder and you have a nursing cover or a shawl that will cover you, because you have all those, so you've prepared. You now sit in a comfortable place and then get your baby to the breast. Your baby might be crying, which will be bringing attention to you. Don't focus on that. Let me repeat. Your baby might be crying, which will bring a lot of attention to you. Please zone them out. Like just internalize yourself, zone every voice out, because if you're dwelling in all that noise and the thoughts of people staring at you, it makes you a lot more nervous. It makes you a lot more cautious of your environment, and it will be harder for you to do it discreetly. Do you understand? So if you're out and you catch your baby showing you the first hunger cues. If you don't know the hunger cues, hold on, I'm going to do another video on that. If you're out and you find your baby showing you the early hunger cues, hand to mouth, just those early signs, please find a spot and feed your baby. Don't wait till the last stage of hunger, which is crying, because when they're crying, the attention comes. But even if you get to that crying stage, remember, as I said, zone every thought out. Just focus on getting your baby to the breast. If your baby is having difficulty latching, you can just cover a muslin over you, in the sense that people can't see, like your baby's face might be a little bit covered, but you know what you're doing on the inside to just get your baby's mouth on the breast. Okay, so that is what you do once you just find your spot. Next thing, this is something that I should have mentioned before you even go out. Have an answer, because you must and always have people that will talk and have people that will stare. That is a must. You must and always, like, have somebody that will stare at you because you're not seeing, or somebody that will talk. Some of the stares are not like a mean stare. Some of them are just positive. Some of the talks as well are also positive. I had an elderly lady. I was in a coffee store having my tea. Why not say my newborn? And she passes and she's like, your baby should pay for that drink as well, because you have paid for your drink. So that was a warm comment. So we just smiled and she was like, you're doing a good job, and she went away and I continued. So, but just know that you can have it either way. The looks and the talk can either be positive, affirming what you're doing, or it can be negative, making you feel even worse as a person. But have an answer and a look for the negative ones. If somebody is giving you a negative look, look them in the eye and stare them down, and then walk away. If somebody just stares at you, look them in the eye and stare them away. I've read an article where somebody said a mean thing to her, and she just brought out her breast, as you know, like how when you can press down on your areola and the milk will just spray. That was what she did. You have to own it. You can't let somebody control you, especially when you're dealing with a baby. If you're dealing with a fellow adult, that makes sense. But when you're dealing with a baby, that a baby is crying and your baby needs food, you as a mom, your instinct is to feed that baby, and nobody should tell you otherwise. Nobody should make you feel bad for doing that. Nobody should make you feel anything different, because they are the ones that have the problem, not you, not your baby. So if, let's say, you are in a place and then the person comes to you and tells you that you should go and use the restroom, that you should breastfeed your baby in the toilet, you told the person, no, please, we don't eat in the toilet, do you? Simple, straight up to the face. Just don't let anybody intimidate you. You need to understand that it's your right and it's your responsibility to feed your baby. Every other thing anybody says does not make sense. Okay? So hope that makes sense. Do not let anybody intimidate you. Feed your baby, feed your baby, feed your baby. So luckily there are some like breastfeeding pods where moms can go and nurse their baby. A lot of them are coming up, and if you find yourself in a place and there is something like that is available, or there is a breastfeeding room available or a nursing room, take advantage of it. But this is my own take. I go to a shop and I'm trying to buy something, and my baby is hungry, and I know, like, I really need to be done with this shopping. I really need to finish up and leave this place. I can't stay all day at the mall. Personally, with this my second time experience, I don't go and sit in a nursing room trying to breastfeed. I put my baby on my breast. All you have to do, if you're like on the aisle of a shopping center, like in a shopping store, and you're just on the aisle, you just need to just face like the wall of the aisle. So you're on an aisle, you just face the shelf. Nobody is looking at you. So you don't need to feel anxious. And then you put your baby in the breast, make sure everything is in order, hold your baby, and continue your shopping. This is what I do. In church, I don't go living to some room because I cannot even hear what the preaching is all about. So, as a nursing mom, this is my theory. If I can't sit and hear everything, except you have a church where when you go somewhere else to nurse your baby, you can still hear everything and you can still be involved. But I find it that some of the churches I've been to that have had a place for moms and babies, when you go there, there are like so many babies, so it's like a play area. People are talking, people are making some noise, and then it's hard for you to understand or pay attention and really pick out um things from the preacher's teaching. So for me, instead of doing all of that, because my church doesn't really have that kind of space, except I'm going to the children's class, which means I am tuned, I'm removed from the adult preaching or whatever is going on. So I sit wherever I'm sitting and nurse my baby. Most of the time, like I will tell you, my baby doesn't get to that stage where they're crying, like, and I feel everybody's looking at me. But today, like today was an example why today was an example, which is why I'm doing this video today. It really happened in a way that I was with my baby, and next thing he was crying, and I was trying to put him in the breast and he was struggling. Like I couldn't tell what he really wanted, but I'm in church and I need to sit in church and listen. So if you are in church, it still goes back to all the points I've listed. Your outfit matters. You have to prepare from home. So you cannot wear your traditional outfit that, like you even had to breathe in for them to zip it. And there is no, like the zips that come with nursing tops. There is no, like, you're just tied inside this clothes. You can't plan and execute nursing easily outside in the public with that kind of clothes. It gives you a little bit of challenge, to do. So, but what I recommend, dress appropriately, like, which is breastfeeding friendly. And when you go to church, always a tank top is really, like I said, you don't need like a specific nursing one. You just need one that can be stretchy, that you can still pull down underneath your bra and still access your breast. So, like, but with this kind of transparent outfit. So how did I nurse my baby? I put a cloth over my shoulder, so that cloth covered this my net top, and I still did the same thing, unclipped the nursing top, the nursing tank top, and then before unclipping my nursing bra, and I nursed my baby and he was okay, and I got to. So this is a skirt I tucked in, so that means I had to like try to find a way to put everything back in order after nursing him. So my last point on this is practice. Practice makes perfect. If you sit her at home and overthink it, you would not really actually get to do it. So it's good to watch something like this, have an idea of it, plan, like I said, mentally, physically, and have your answers ready. The people that are nice to you, smile and respond nicely to them. There are moms that go around and they'll tell you, oh, you're doing a good job. They will give you like a thumbs up. That is warming. Like, if you are a nursing mom and you see another nursing mom doing that, please, I will encourage you. Just tell the mom, good job, mom. And just, that's simple. She will smile. You don't even need to say. She will smile and she'll be happy, because as she's sitting there, she's feeling conscious of people staring. She's feeling conscious of people that might come around to say something. So just share some smile, share some encouragement, and practice all I've said, and go out there, be bold, nurse your baby, nurse your baby. And if you have any bad experience, let's share with us. Basically, if you have any experience that you've had nursing, please share with us. Positive, negative, share with us. Like I said, I've had good ones. I've not had a negative experience because I really have my answer for those. So I've not had that. I've always had like positive experience, people affirming that I'm doing a good thing. So that brings me to the end of this video. Hope you learned something and that you can really go out there now and nurse your baby boldly without feeling ashamed. You're doing a great job, mom. Continue. You're amazing. You're amazing. You're amazing. And see you in. Get to click to subscribe, to like, to share with your friends. Please encourage me, encourage me, encourage me to continue doing this. Bye, guys.